Welcome back on this Health and Wellness Thursday. We are going to talk about diabetic neuropathy. This is a very awful condition many individuals struggle with. And I recently spoke with a prominent physician as well as one of her patients all about some advancements, treatment, and much more. Let's take a look.
Approximately 34.2 million people in the U.S. have diabetes, and 20 to 25% of them will experience painful diabetic neuropathy symptoms that can significantly worsen their quality of life. It can cause numbness, tingling, and burning pain in the limbs that can prevent people from doing simple tasks such as driving, walking, or getting restful sleep. People with the condition now have a non-drug solution that provides an alternative to conventional medical management. Hfx for PDN is a sensory spinal cord stimulation system that uses 10-THz therapy to treat pain from diabetic neuropathy. Hfx is the only spinal cord stimulation system approved by the FDA with a specific indication to treat painful diabetic neuropathy. Joining us with all the details are Dr. Erika Petersen, neurosurgeon and professor at University of Arkansas for Medical Sciences, and Lee Cagle, one of Dr. Petersen's diabetes patients who has experienced the benefits of this therapy. Thank you, both of you, for being here today.
Honored to be here. Thanks.
Dr. Petersen, tell us more about this condition and the struggles it brings to people suffering from it.
Sure. So painful diabetic neuropathy is a complication of diabetes that probably right now affects about 8 million people in the US. The idea here is that with chronic high levels of blood sugar, tissue in the body becomes damaged, and that includes nerve damage. And when nerves are damaged, you get numbness, and then you can also get pain, and that can be burning pain. It can be painful cold, pins and needles kind of sensations, or sharp stabbing kinds of pains. And this is something that limits people's ability to do what they need to during a day. They can't wear shoes, can't walk barefoot on carpet or a regular floor, can't even get to sleep at night. And so people have tried medications, both creams and pills, and some of those can help for a little while, but they can have side effects, or they may wear off and not work over the long term. The other thing is that we're talking about patients who have diabetes. They're already taking a lot of medicines to manage their blood sugar control and may not want to take more medicines. And so looking at a non-drug option, which is what Hfx for PDN is certainly an appealing solution for people in this circumstance.
And Dr. Petersen, how does Hfx for PDN work?
Yeah, so think about it like a pacemaker for pain. It's an implanted device about the size of a small pacemaker underneath the skin. It's a battery pack that delivers a specific signal in through wires that go underneath the bone and over the surface of the spinal canal into the spinal nerves. And those impulses are designed to block the pain messages that are being transmitted from the nerve damage in the feet into registering in the brain. And so by delivering those impulses, we can see a significant improvement in terms of people's ability to do their day-to-day because their pain is significantly reduced.
Lee, how are the symptoms of PDN impacting your life? What were you doing to manage your pain before receiving this device?
But before receiving this device, there was hardly anything to do. I went and saw a neurologist, and he put me on this machine, and he says, yep, you've got neuropathy. With continued maintaining your levels of your diabetes, your glucose levels, you might get some feeling back, and it might ease some of the pain. It might not. And then he walked out. He prescribed me some medication, and that was the last I heard from him. And it kind of made me feel hopeless because there was nothing that I could find at first. And then once I saw a trial study for the Hfx for PDN here at UAMS, I decided I had to give it a try. So I contacted them, and I'm thankful I did.
And Lee, how has Hfx for PDN changed your life? Would you recommend it to others?
I'd most definitely recommend it to others. Before this device, I was miserable. I'm a construction worker, work 10, 12 hours a day on my feet. When I get home, first thing I do, take my shoes off, kick my feet up. With this device on my back, I can be able to get home. I'm able to do chores around the house. I have a better mindset. I'm more pleasurable to be around as well. My friends and everything, when I was dealing with the PDN, they're like, man, what's wrong with you? What's going on? How come? And then they slowly start distancing themselves because I was miserable. I didn't even want to be around anybody myself. This thing is night and day. I'm able to go fishing again. I'm able to go out for walks. I'm a normal human being again, thanks to this device.
Really life-changing, it sounds like, for Lee. And Dr. Petersen, how can people learn more about HFX or how to access this therapy?
Sure. So it's now FDA approved, and so they can start a conversation with their doctor, but they can get more information online at hfxforpdn.com and take a questionnaire, and that will then unlock the conversation, and they can then take that to their doctors or to an expert like me or others who do spinal cord stimulators.
Well, thank you so much, Dr. Petersen, for telling us more about this important therapy. And Lee, we appreciate you being so honest and vulnerable with sharing your story. It's great to hear how much this has helped you, and I know it will help many other people. We appreciate both of you spending time with us today. Thank you.
Thank you so much.
Yes, thank you.